It can now be said our president is traveling from hotspot to hotspot. Tomorrow, he'll be speaking at an indoor rally in Arizona. The state has been recording a surge in new cases, logging over 2,100 new coronavirus cases today. The number of COVID-19 hospitalizations in Arizona also reaching record highs. As of Sunday, 84% of ICU beds were in use. For more, we are happy to welcome to the broadcast someone acutely aware of the dire situation in that state, someone who will be among the first to know if the president's rally indeed results in its own spike. Dr. Murtaza Akhter, a clinical assistant professor at Arizona University's College of Medicine in Phoenix, also happens to be an expert on how racial inequality and income inequality affect longevity. Doctor, full disclosure, I saw you on another network, and full disclosure, you expressed your anger in the interview I saw, which is rare these days among physicians, but we could probably use more of it. So when you hear people in the Phoenix area say, I'm not going to be ordered to wear a mask, I'm going to go without a mask, in effect, to show my support for this president. I know COVID's out there. I'm willing to risk getting it because I want to go to this rally. What do you say to them?
Yeah. Thanks for having me, Brian, first of all. And I'm impressed that you're watching competitor stations and caught a wind of me. For the people who aren't wearing masks, I mean, we have this idea that you can do what you want, but that's just not how our society is built. You clearly can't do whatever you want. We've had rules and regulations in place for all sorts of things. The reason this one is particularly concerning is because masks aren't there just to protect the person wearing the mask. It's also there to protect other people, perhaps even more so. And so to say I'm going to do whatever I want to not wear a mask, listen, if you're a hermit and live by yourself, that's fine. But as soon as you're coming into contact with other people, here in Arizona, we've got a lot of elderly people. And I just crunched the numbers literally last night. Those people who are above 65 and have COVID are 58 times more likely to die of it than somebody under 45 with COVID. That's 58 times, not 5 to 8, 58. And we have a lot of, snowbirds here, and just go around saying, listen, I'm young and healthy, and young and healthy people can get sick too. I've seen them literally today on my shift, which I just stepped out from. But to say not only that I don't care, but also I don't care about others is really, really selfish.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.